we start, sir? Right now, we are having almost 309 participants with us. So it is a great start for this webinar, sir.
Right, Parul. So very good evening to all the delegates who have joined us for this today's webinar. Thank you so much for giving your valuable time for this webinar. It is totally on the novel vaccine, which is rabies in our division. So before taking lots of time, I would like to welcome our today's speaker, Dr. Nitin sir, who will take the session. And not taking much of time, Nitin sir, over to you, sir.
Thank you. Very good evening to all respected doctors and all other members of Team Cadila. And thank you giving me such a nice opportunity to just a short and brief discussion on your new launching the rabies vaccine. And the tagline is very nice. You can aware 1, 2, 3 rabies free. So it's quite very innovative and very effective. So I'm using in my patients. So coming to the today's medical topic, the rabies, anti-rabies vaccination. So all you know that it is a disease, zoonotic viral disease, and it is a fatal disease if it was untreated in both animal and the humans. The already vaccines which are already launched in previous past years, 2 types of vaccine everybody knows, nerve tissues, and second is cell culture vaccines. Now WHO recommends replacement of nerve tissue vaccines with the more efficacy and safer vaccine which developed through cell culture vaccine. So today's the topic, the new invention, the rabies. So next slide. It's not working. The novel 3-dose G protein vaccine, ultimate key for the compliance. So globally, around 59,000 human deaths annually, which are highest in the India. India had around 20,000 human deaths in a year from rabies, accounting for 60% of the rabies death in Asia and around 35% globally. 91% approximately deaths in India occurred in rural areas. So the currently management, which is infashionable, local wound treatment, as you all know, first aid, we will ask for the patient to just keep the wound clean with the running water for around 15 to 30 minutes and disinfect it. Okay. This is the rabies post-exposure prophylaxis. Yeah. And active immunization, which you know already in a scenario, 5 doses. Now the 3 doses in launched. So you know the 3, 7, 14 and the 28 days. That is the booster dose for anti-rabies vaccines. Okay. Now we are coming on to the passive immunization, and now the current challenges for post-exposure prophylaxis is first. So non-compliance, and currently rabies vaccines are cell culture vaccines. Inactivated vaccines are more than 50 years. That is the old technology. So inconsistency in potency, stability, availability, short supply, and adverse events. So now coming to the anti-rabies vaccine compliance. The compliant who received the full course of anti-rabies vaccine, that is the scheduled doses of ARV on the recommended dates. Delayed compliance who completed the scheduled dose of ARV within the 16 days but deviated from the scheduled regime. Dropout, non-compliant who had taken at least 1 dose of anti-rabies vaccination after the animal bite but not completed all the scheduled doses. You can see this chart. Non-compliance to 5 dose, that leads to the cause of death. So you can just look at on your screen. It's like nature of the studies, their nature, age, and some studies, clinical study trials, nature of the animal, street dogs, study on the street dogs, which killed soon. In some people, its status unknown, the animal was unknown. And the post-exposure prophylaxis exercises में 3 doses given, purified check embryo cell vaccination 0237 and no rabies immunoglobulins presently. Chronology of events, clinical features, dogfight, CSF findings, total cells, and UC diagnosis conducted rabies encephalitis. Confirmatory tests, rising serum, MRI findings was there, and lots of there. The reason of the death may be due to the lack of administration of rabies, immunoglobulin, or poor compliance to vaccination. Next. The compliance to the post-exposure prophylaxis among animal bite patients, a hospital-based epidemiological study is there. You see the study graphs is there. Compliant, the blue color shows 48%. The delayed complaint, it is 6%, and 46% is a non-compliant. At Safdarjung Hospital, New Delhi, and the number is 360 animal bite patients, and pre-designed, pre-tested structured questionnaire was administered by the interview technique. The 53% were non-compliant to all full course of ARV. The compliance to anti-rabies vaccination in post-exposure prophylaxis, you can see the chart, 100, 88, 85, 70, and 60. The day 0, 100 of the patients have taken the first dose, 0 dose, just as all you know. And after the second dose, that is on day 3, only 88 patient turn, rest of unknown. They went off it on 7 dose, third dose on day 7, only 85% turn up for the vaccination, ARV, and day 14, the fourth vaccination, that is only 70% turn up for the vaccination, and you can see and you will saw only 60 out of 100, only 40 patients are gone. Only 60% are turned up for the booster dose, that is on day 28. So at Municipal Corporation Hospital, Bangalore, number of patients, 215 animal bite patients, 1 dose of rabies vaccination administered intramuscularly on days 0, 3, 7, 14, and 28 as the post-exposure prophylaxis. Also measures constraint for compliance to complete course. The compliance rate for intramuscular rabies vaccination was 60%. Now you can see another chart. There is a big blue like a moon category name and percentage is there. So interferes with the school timing, distance of the hospital 11%, incurred 13 forgotten, and category name percentage, this is wages, that is 14%. So this is most effective is 47%. Now you can see the live attenuated vaccines of spinal cord, inactivated nerve tissues, inactivated vaccines, and cell culture, which we are talking inactivated vaccine cell culture. So it was established in 1885, the live attenuated vaccine. Now in 1900 era, inactivated vaccine launched. So, and now after 1976, inactivated vaccines in a fashion. So standard immunogenicity lyophilized injection, that is 5 injections. Now currently we are using in medical practice for the patients. Non-compliance led to evolution in treatment design from 31 dose to 5 dose, and it's still meeting the unmet medical need, introducing the novel vaccine with the simple and shortened design. Next. Novel 3-dose recombinant rabies G protein vaccines. First protein subunit vaccine prepared by VLP platform technology. The first vaccine 3-dose intramuscular design, that is 0 dose, 3 and 7. Only a 3 dose design, and it have a better compliance due to easy to flow design and less visits to the hospital, and very convenient, ready to use, no reconstitution needed. Clinical studies. VLP technology, the pictures is showing the net. You can see the your slides. It's good slide. You can see that how it is growing, like this vaccine, cell culture vaccinated, newly launched vaccines, G protein, VLPs, virus-like particles, and they are capable of inducing a strong humoral and cellular immune response, and VLP as vaccines. So very nice. So some clinical study phase safety and immunogenicity of a novel 3-dose recombinant nanoparticles rabies G protein vaccine administered as simulated post-exposure immunization. A randomized control program phase 3 clinical studies are visible. Next. To evaluate immunogenicity and the safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. You can see the 037 days design and compared to the 037 14 and 20 days old design. The subjects and 207 subjects have taken these designs. After it, the total subjects is 800. Randomized is 2:1. You can see the results are considered across the different age group and genders. Observed difference is 1.52%, that is 95% CL2.18% to 44.17% with the pre-specific margins of -4%. And the non-inferiority for seroprotection primary endpoint day 14 and 42 were met. Test and the comparator are identical in seroprotection rate both on days 14 and 42. You can see the efficacy and the safety of the novel 3-dose and has a better safety profile as significant less AEs and compared to reference vaccine. You can see the graphs step by step. Yes, next. Now coming to this conclusion. It's a 3-dose was vaccine, less adverse effects compared to the reference vaccine. Novel 3-dose was found to be a safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. So it's, you can see India Pharma World Reward Pharma Innovation of the Year by the Economic Times, and another achievement Golden Globe Tigers Award Malaysia for Innovative Product of the Year. The injection name is Travis. Thank you so much. It's a short and brief discussion of rabies and vaccination. Yes.
Thank you so much, sir. Thank you for giving your valuable time. Sir,
thank you so much for listening me.
On behalf of Catalog, we would like to thank you. Sir, since you are using this brand from the day one, so can you share your experience regarding this for the audience benefit?
Yeah. Some patients are actually I was also keen to share my experience with the patient right now. Actually, last year we are still when you just launch these vaccines. So it's first it's my मतलब I've said यार 3 क्यों होती हैं बस 3 ही हो गई यार ये तो खत्म होती जा रही कम होती जा रही कुछ दिनों में 1 आ जाएगी तो ये आया कि हाँ तो but I tried to my patient first the patient which come in my OPD after a dog bite and he asked what is the reason so I said yeah this is the modern technology of science ठीक है so you have known you have a 14 injection on your tummy on in your stomach abdomen okay then it is turned up to the inactivated this vaccines turn up to the cell culture vaccines so it's very compliant and very easy so 1 2 0 3 4 7 and 14 so it will turn up to the but after all 3 doses in very short duration and he came again in my OPD and say sir मैं उस हॉस्पिटल में गया था वहां नहीं मिल रही थी अभी बट अभी आपके आया तो आपके यहाँ मिला तो he also thanks to me and you Cadila also ठीक है कि it's very good.
Thank you, sir. Thank you for your experience and thank you for your confidence regarding this new introduction.
I recommend more patients to this new vaccines and hopefully the result will always good as earlier and all the best to you and your research team. Thank you so much. Cadila. Thank you.
अगर सर किसी का क्वेश्चन शो कर सकते हैं सर आप कमेंट बॉक्स में डाल दीजिए ठीक है, फिर क्लोज कराते हैं, मतलब कभी कोई क्वेश्चन नहीं है तो ठीक है। सपोर्ट टीम तो फिर इन करिए। तो थैंक यू वेरी मच फॉर ऑल डॉक्टर फॉर गिविंग अ वैल्यूएबल टाइम सपोर्ट। थैंक यू।
Tech support, you can conclude the session.
ओके,
ठीक है, ओके ओके। टेक